life. This is about life in Laguna. Now we are at the stand, which is one of Laguna Beach's most incredible. What would you call it? Just like it's part of our culture. It's just a legendary lunch and dinner place. Healthy, yeah, vegetarian. Edward has been the proprietor here for a long time. They used to have a place downtown where La Serena is now. And so great food, all organic. A lot of wonderful people work here, and look at all the wonderful people that eat here. Look at all these wonderful people that eat here on a regular basis.
Community vibes.
Health-conscious people. So what we're going to do until another table opens up, we're going to sit over here, and I'm going to talk to you today about individualized nutrition and blood testing and laboratory testing, so people can actually figure out exactly what their body needs and what they should be on, instead of just going to a health food store and say, oh, I should take that, and I should take this, or I should take that, or I should take this. It's gotten a lot more specific now with functional nutrition.
Can you do it via email? Can I send you a blood sample via email and you could do it?
It depends on how recent it is, and also what your symptoms are. If you filled out, when you come in, fill out a metabolic questionnaire which tells me what your main things are that you're dealing with, and what you want to accomplish. And then I'll take a look at all your symptoms. It's called a metabolic questionnaire, and you rate any symptoms, and that lets me know if there's tendencies towards neurotransmitter problems, or if there's digestive issues, or thyroid, or female hormonal problems, or chemical intolerance. Yeah, you fill that out, and then if I see the blood, then I can do a consultation or order any other labs.
She's watching us online, and then she's also here in person.
Oh, that's wonderful. That is so funny. I love that.
Okay. Yeah, well, when you come in, we'll get it all set up.
Okay.
All right?
Okay.
So, you know what we could do?
Bye.
You guys aren't leaving right now.
No, we're sitting.
No,
We're going to go sit. Let's go sit over there. We'll find a little corner, and we'll continue talking about how a person can avoid having health risks, like Dr. Marcela. I just talked to her before I came over. She said, you know, one thing I'd really like to follow up with from last week's talk was how to prevent people from having cancer, how to stay healthy and decrease your risk of getting cancer. So she said, would you follow up and start talking about the different laboratory tests and those kind of things that we do to help people to really start to get healthier and healthier and decrease their risk of getting cancer. So that's what I want to follow up with today. So let's walk on over here, check it out. We got all these nice little nooks to be able to eat a
Or do
meal.
you want to order any food first?
Yeah, we could order something.
Hungry boy.
I like that. I like that idea the best. Catherine Winder said hello.
Oh, she
Oh,
did.
Catherine. We love you. We miss you always.
You're
You're the
one
best.
of our favorite people on the planet.
Yep.
We know that.
That's a big one. Look at this menu, you
Look
guys.
at this menu.
Oh.
Amazing. So good.
Somali.
The hummus bowl is epic.
Pita pockets, sandwiches. Dang.
What to get? What to get? What are you thinking?
Well, I'm gluten-free and corn-free, so I've
why
got
you're here.
You know, that's what I've got to work with. So I've got to
How are
know
you?
what I can have.
Good, how are you? Good. We are just deciding, looking over everything.
I know
We're on
what
Facebook
I would
Live
like.
today. We're doing lunch with the doc.
We're having lunch with the doc. So you're now worldwide. Hey,
Famous.
what's up? I didn't know you worked here.
I've been here for like a year.
Have you really?
Yeah.
Censor it.
Kids.
We're actually filming Facebook Live right now. We do a little TV show every week at 12:30. It's called Lunch with the Doc.
Oh, really?
So
That's
today
cool.
we're featuring the stand.
Nice.
Yeah, and all the good vibes and all the good food.
Right on.
Yeah.
So this is Sensor
Love
A.
it.
Hi, Sensei.
Hi. Nice to see you.
Yeah, and Maria.
Hi, Maria. Nice to see you. Nice to
So
meet
do you guys think you know what you guys want?
Avocado sandwich.
You know what you want?
I think maybe the hummus bowl.
Okay.
And then we should split a little vegetable mixture drink.
Okay.
Sounds great.
Yeah.
All right. So we're good to go.
Cool. What are you getting?
I'm going to get a side order of guacamole,
Ooh.
and I'm going to get a side order of jicama. and have guacamole and jicama as my chips.
Wow. Okay.
Look at you.
Keep the carbs low. Don't aggravate my immune system. We're ready to go. If you are, you want to be out of the picture? Okay. So no filming her.
Okay, I'll come over here.
All right.
I'm not filming you.
All right. She's not filming. All right. So I'd like a side order of guacamole.
How much guac would you like?
That one.
That was easy.
And I would like a side order of jicama.
Samoa, what's your favorite thing here?
I love the hummus bowl. It has hummus, guacamole, brown rice, beets, carrots, this amazing dressing.
That's going to be my
Yep,
chips to eat.
cabbage, so yummy. And their fresh squeezed vegetable drinks are amazing.
And then you want avocado sandwich.
And he wants an avocado sandwich.
Ryan's getting an avocado
And
sandwich.
what kind of bread?
Your favorite bread.
Whichever one you like the most.
Let me switch it around and
what
tell
do you
me.
have?
Oh, I'm having a hummus bowl. And then we'll get
I
the
want to get one 24-ounce vegetable mixture.
24 ounce.
Sensory, can you go get a jicama from the back?
Just amazing fresh food. We love it. It's all vegetarian here. And is it all vegan too?
All vegan.
All vegan, all
Did you
vegetarian.
bring the company credit card?
You know what?
No.
I forgot.
All right. We'll use that
Whoops.
for here.
Sometimes you forget.
Sometimes you forget. So Dad was just in Hawaii this past week and had an amazing time. Talk about, things that are good for your health, how stress can be very taxing on your body and your health in general. Well, he had a nice little stress relieving, relaxing, fun time.
I did.
He did. I mean, he's wearing the shirt to show for it, Gotta get those Hawaiian vibes in here. So he's living it up, which is really, really great. Wish we could have been there with him, but we're just stoked for the mommy and daddy to be having their Hawaii time. So today he's going to talk a little bit about nutrition and specific nutrition for your body, so that's going to be really great. And one of those amazing things is to learn how to eat fresh and organic, just like we're doing here at Stand.
However
This
you would
vegetable
make it for
mixture,
yourself.
what's in the vegetable mixture? Let's just
Just
it has
however you do
celery,
it.
cucumber, zucchini,
Is there an extra charge?
and then spinach, kale, broccoli,
No, but I did
chard, parsley, beet, carrot, apple, and lemon. Whoa, that's a lot of nutrients that are going to be in this vegetable mixture. Very excited for that. So we're going to share that little drink and get it going. So how many of you viewers that are out there have ever been to the Stand? You can just comment. Just be like, yep, been there, go there every day, been there once. Just let us know. Get involved. We love when you guys ask questions and engage with us, because that's what's so cool about a live video is you can literally ask Dr. G any question you've been longing to ask him for years, and it's just, this is your opportunity. So go ahead and ask any questions, write any comments. We're here for you.
Saul Guzman says hello, doctor.
Oh,
the same thing, but if I showed you back
Doctor.
here, that's all I've charged you so far.
we say hello back. So glad you're watching.
68, so I still have to charge you 37.
So,
So do you want me to sign this one? Do this one again?
No, I'm gonna have to put your
tell me what you ordered, right?
I ordered an avocado sandwich.
Oh, an avocado sandwich. What's in that?
Well, I was looking at their Instagram earlier to post up where we're going to be. That was one of the first things I've seen, and I've never eaten one.
That looks pretty amazing.
Catherine says she's been here a few times. She loves their soups.
Oh, their soups are so good. It's kind of a hard thing to find a good soup in town. Most people, or most places just don't have very many options for soup, especially like vegan, gluten-free, but this is a good place to go. Catherine, you're so right. You just know the spots. You're such a Laguna girl.
Do you need my card?
Nope. No.
Got it. Thank you. Gonna find a little spot. Should we post
You
up
could sit
here?
right here. Or she could sit right there. You could sit right there. Or we could sit back
I
yonder.
think this.
Okay.
Unless we can always move over there to that cozy little spot, but I think this works.
I think this works.
Alright.
I
Do you
can
have a
sit right
spot?
there and then film you guys this way.
Perfect.
Did he do it yet? Still trying to sort out the financial issues, are you?
Yeah, they had a computer card malfunction, so
Oh, okay.
we're just being patient.
We love patience.
Okay.
Fruit of the spirit. Yep. All right, so you guys can sit right there. I'll cradle over here.
Oh, there you go.
All right.
Perfect. We're set up.
So now you want to talk also just about reducing stress.
Well, I was just saying, I mean, you were definitely reducing some stress this week in Hawaii. So tell us about how important it is for your health to be able to reduce stress.
Well, you know what's so great is that there's time for work, there's time for sleep, and there's time for play, and there's time for love and building friendship, and it's all got to be balanced, right? Because if you don't keep it in balance, then you're gonna have things out of balance, and when things go out of balance. This is Pam. She is one of the best.
I just wanted to get hi, Mom.
She's one of the most amazing patients,
She's
and
taught my 3 daughters how to play piano.
And I love this family.
I don't think she's ever.
I gotta get. Yeah, it's never too late.
Yeah, it's never too late for you.
Anyway, love these guys. So listen up. I got a lot to tell you.
She's been a great patient and referred a lot of wonderful people to us over the years, and she's on a roll.
Feeling good.
She's on a roll, feeling good.
Feeling good.
Awesome.
Woo!
love it.
So anyhow, it's about keeping it all in balance, and vacations are a great way to do that, especially if you can go into a chill mode on vacation. If you can get into a chill mode, then you're not always bebopping and have too much on your agenda. So it's like time to just relax, hit the beach, go to a campground, what have you, whatever you can do, just take the time to do it. So from there, let's talk more about some of the new things that are out with laboratory testing and nutrition and figuring out what you need. Now, thank you so much.
I'm gonna grab the juice.
Okay. Juice it up.
So, for example, like I was telling that one patient, you can fill out a metabolic questionnaire which basically runs through multiple amounts of symptoms, but symptoms that are related to specific organ systems and how those organ systems are running. For example, is there a digestive problem? Is there a liver problem? Is there a gallbladder, kidneys, your electrolytes, your pH, your pituitary gland, your thyroid, your adrenals, your sexual organs.
Come on, dude.
It's okay. Your neurotransmitters, even sometimes serotonin or dopamine or acetylcholine or GABA. If people are really anxious, a lot of times you can shift those neurotransmitters around and really get things back in balance. So that's a metabolic questionnaire, and then we determine, based on what the person's symptoms are and what they would like their life to be like and what they would like to feel like, then we determine what test would be the most beneficial. So we'll usually do a basic comprehensive overall blood panel. Some people think they've got a comprehensive one, but it's not that comprehensive. But when our nurse or our medical doctor order labs, some of those labs can go through their insurance, and then some of the other labs we get through a wholesale clearinghouse and don't need to go through insurance, but you end up saving a whole bunch of money on that because we just give you the wholesale price, and we just are paid for our time to consult and go over the lab results. So secondly, that's a basic blood panel which checks your lipids, checks your mineral levels, your white blood cells, your red blood cells, your iron levels, looking for areas of inflammation. Because remember, Time magazine came out about 7 years ago on the cover, and it said inflammation, the true cardiac risk. The biggest cardiac risk is not in your cholesterol levels. That's been misproven. And the pharmaceutical companies, of course, the number one drug they give is for high cholesterol. And now they're even lowering the cholesterol level so they can give more of the statin drugs, Lipitor. It causes muscle wasting. There's a lot of side effects, and a lot of times it's really not the key thing. The key thing for inflammation is your homocysteine levels and your C-reactive protein levels. Those are the things you want to really look at, because inflammation is really what causes pain, it causes immune system problems, and it also causes cardiac risk, because it causes inflammation on the arterial walls, and that inflammation then draws plaque into the area and starts to line the linings of the arteries with plaque, and can cause a lack of blood flow to the heart. So really the inflammatory markers have now been proven to be the most important thing to decrease your cardiac risk. So those things can be found in a basic blood panel as well. And there's also screening for a thyroid problem in our basic panel. And you know that statistics say that 80% of the people that are diagnosed with hypothyroidism, that are taking thyroid medication, those people actually have autoimmune thyroid, which is called Hashimoto's thyroiditis. And it's really not a thyroid problem as much as it is an immune system problem, an overactive immune system that is attacking the thyroid cells. And because it's attacking the gland, the thyroid cells that are in the gland, it makes it so the thyroid can't work. So a lot of these things can be ruled in or out with a basic blood panel. The other things that Dr. Dominguez has brought to the clinic is the NutriVal. And the NutriVal can also be paid for by insurance. And the NutriVal tells you your nutrient status in a lot of different things, so you can really get very, very specific about what nutrition do you need. Are there certain B vitamins you need? Do you need specific minerals? Are there pathways for detoxification that your body doesn't have ample nutrition for, because then it can't detoxify. And if it can't detoxify, that's going to lead to all kinds of immune problems, challenges, losing weight, pain, rashes, all kinds of problems. So that's called a NutriVal, and that's now available through our clinic. Another thing that we're also doing now is doing digestive analysis and intestinal function analysis to see how people are digesting their food, and screening them for parasites and bacteria and yeast and fungus, and take a look at their flora, their balances of their flora. How's the flora look? Because that's called the microbiome. And the microbiome, they're finding, is so important, because it's the level of the ratio of the good bacteria in our system is really what keeps our immune system strong and keeps other bugs from being able to take over. Thank you.
What kind of juice you got?
Yes, coming.
Here it is.
She's gonna come get it. So, you know, Scientific American on the cover 2 years ago said, did you know that there are more cells of bacteria than in your body than there are your own body cells? That's called the microbiome. And so the healthier that our system is with good flora, the healthier we're going to be. Now guess what destroys our flora? Antibiotics.
Here we go.
And sometimes...
Look at the stand.
Yes.
There's the little hummus bowl.
Booyah.
There's my jicama and guac. There's Raya's avocado
Oh,
sandwich.
this looks epic. Woo!
And are you going to be able to film and eat your sandwich at the same time?
He can do it.
Probably can't.
I think so. So amazing.
So those are all things that can be done in a digestive analysis. That's from Genova Diagnostics. And then we're even doing new laboratory testing with looking for if there is an overgrowth of bacteria in the small intestine. That's called SIBO, S-I-B-O, small intestine bacterial overgrowth. And we also do a test called the hydrogen methane test with lactulose, and you basically breathe into a little baggie every 15 minutes and send it to the lab. and based on how much hydrogen and methane gas is in your breath, it'll tell you if you have a diagnosis of small intestinal bacterial overgrowth, which is so incredibly prevalent. It's just been hard to diagnose in the past. So a lot of people that have had chronic immune issues or digestive issues, or they bloat easily, or they have a hard time losing the extra body fat, this hydrogen methane test can rule in or rule out if a person has SIBO. And I took the test and found out that I had that. I went on a protocol to fix it, and it has really helped me so much. Another laboratory test that is now coming out, and we're going to have a whole talk on this coming soon, is going to be having to do with genetic weight loss. And it's actually a genetic test. It's a genetic test.
Good. We're just doing
Yeah, hi.
lunch at the dock. Awesome. We do it Facebook Live every Wednesday.
Oh, fantastic.
So fun.
Well, enjoy yourself.
Thank you.
You look beautiful.
Thank you.
You look very dashing.
Thank you
You've got
very much.
nice colors to represent.
All right.
Have a good one.
What's her name?
Stacy.
Stacy.
My old voice teacher. She's amazing.
Oh, yeah. She was,
Yes.
So the other thing is basically it's a genetic test by taking a little swab you rub on the inside of your cheek. It gets sent off to a lab, and the lab then determines, based on your genetics, what kind of diet for you with your carbohydrates, fats, and proteins is best for your body to get to its ideal weight and to burn fat naturally. Also, it tells you what kind of exercise do you need. Do you need high intensity exercise? Do you need longer duration, lower intensity exercise, circuit training, those kind of things? Your genetics tell you. And what they found is people have a 3 times faster and more efficient weight loss than if they do it on their own. So we're just getting ready to launch our whole genetic weight loss program that's coming right up. My daughter and I just sent away for it, and we're going to start our program and then make that available for people too that are really serious about, just getting down to their ideal body weight and doing it as naturally and easily as possible, and not making it be a big diet, but just understanding how your body was actually formed. So all these things that we've talked about today are things to improve your overall health, improve your energy, improve the way you look, improve the way you feel, and also decrease your risk of cancer. And if anybody has any questions, I don't know if any big questions have come up, I'd be happy to answer them. But just know that, if you ever want to come in and have a courtesy consultation, it's complimentary. We'll do a consult with you and just, talk to you about what's important to you, what's going on with your health, and what you'd like to really be feeling like for short-term and long-term. And that's complimentary. Anybody can come in and have a free consultation with the doc. So, and you also get free lunch with the doc anytime, every Wednesday at 12:30.
Yeah.
So, thanks so much for coming. Again, what were you going to say?
Well, and so as we're talking about genetic weight loss and how amazing it is, keep an eye out for our weight loss workshop in June. It's going to be called Lose the Weight, Summer's Looking Great. I know, I made up the name. Thank you so much. And it's going to be pretty fun. Looks like the date is going to be June 21st, but just keep your eye out. We will let you all know when that's going to be. But that's going to be a workshop all on this genetic weight loss and how to get started and what to do and what the benefits are, and if it's something for you that you'd like to do. As we head into summer, everybody's kind of thinking about that and wanting to be in the best shape they can to get out there and just do the things they love. So we want to make that available to you guys. So that'll be in June. Keep your eye out. And this has been another amazing Lunch with the Doc.
Oh.
We love doing this. So
One other thing, as I'm chewing on a cucumber, we want to reconnect with people. And being here for 30 years, we're actually going to be celebrating our 30th year. This November is the end of our 30th year. And So we want to have kind of a 30-year celebration, but in the light of that, we want to reconnect with people. We want to really make it easy for people to come in and reconnect. So we're going to be offering, there'll be a letter and an email going out. If you're not on our email list, you should call our office, 949-497-2553, and you can be made aware of what the upcoming events are. And we want to give you value. We also would love to reconnect with you, do a courtesy complimentary consult, a brief complimentary exam, a little treatment, and make it really, really, really affordable. Because some people don't have a lot of extra income, and they want to get a lot of value for the least amount of money. And that's what we want to provide to our patients, is more value, less money, and better benefit to you. So be looking for that too. Please call our office and get on the mailing list. Be looking for an email and a Facebook post. All right. Thanks so much.
Happy Wednesday. You are amazing. Goodbye. Blessings.